Hello and welcome to the Egg Freezing Academy. I'm so happy you're here and well done to you for making the first step to taking control of your reproductive health. We know knowledge is power. So we're here to equip you on all the things you need to know before you start egg freezing, whether it be your first cycle or whether it be your last cycle. Hi, I'm Dr. Ravina. I'm an NHS GP specialised in women's health, contraception and menopause. I'm the founder of Zonas Fertility, where we aim to help couples to get pregnant just like you. In this module, I will teach you the 5 top supplements to consider before egg freezing, before IVF, or even before you start to get pregnant naturally. I'll also send you the links of the ones that I recommend in our supplement cheat sheet, which is available in the Egg Freezing Academy. I get questions all the time on supplements, and it's one of your most commonly asked questions. So let's get your notebooks ready and let's dive in. The first is coenzyme Q10, also known as ubiquinol or ubiquinone. And the reason why it's really important to take CoQ10 is because it's a powerful antioxidant that improves mitochondrial function in your egg cells. So to break down the science, mitochondria is basically your energy factories in every single cell in your body. And this energy factory produces energy, which allows toxins in your cells to be removed. These toxins are like free radicals that can cause stress on your eggs and that can cause them to die. So if you have better mitochondria, then you have more energy and then you have better egg quality. It's important that you take this before you start your egg freezing journey because it helps with the maturation of the egg, which is basically what we're aiming for with the self-injections of medication during the stimulation phase of your egg freezing journey. It's important that you take this about 3 months before, and in terms of the dosage, ubiquinol is the more active form of CoQ10. So that means it's more bioavailable, so it's easier for your gut and your body to absorb it. It's recommended that you have between 100 to 300 milligrams of this per day. And we recommend you take this if you're over 35, if you have low ovarian reserve, if you have chronic inflammation like endometriosis. But it is usually more expensive because this version of CoQ10 is the more bioactive form. So it's usually a little bit more expensive compared to ubiquinone. Ubiquinone is recommended you have up to 600 milligrams per day. It contains the inactive form and it's better for younger women. It is also a cheaper version of this supplement. You can buy this in Holland & Barrett and also on Amazon, and I'll recommend the ones that I suggest you get in the supplement guide. Number 2, omega-3 fatty acids, also known as EPA or DHA. These have anti-inflammatory properties, and that helps to improve blood flow to your ovaries and to your uterus. So more blood flow equals more oxygen, which means more nutrients for your egg. It helps to reduce inflammation in your reproductive tissues. So especially if you're someone who has endometriosis or chronic inflammation, it can really help with the development of your follicles in your ovaries. It's recommended that you take this for about 2 to 3 months before your egg retrieval and before any fertility treatments that you have. In terms of the dosage, we recommend usually high EPA, DHA content per capsule. So this is something along the lines of 1,000 to 2,000 milligrams per day. EPA and DHA are long-chain omega-3 fatty acids, and they're naturally found in fish oil and marine algae, and they're essential fats, meaning your body can't make it on its own. You need to get it from food or supplements. It's recommended that you take this if you have PCOS, if you have endometriosis, if you're older than 35, if you have low ovarian reserve, and if you have low AMH levels. The next supplement that I recommend is number 3, and that's myo-inositol. So this supports your ovarian function and your insulin regulation. And this is especially critical if you have PCOS, as it can help to improve ovulation and your cycle regularity, which is often. This is especially critical in PCOS, as it can help to improve ovulation and cycle regularity, and can also help to reduce testosterone that's so commonly seen in PCOS. It can also help to enhance your overall egg quality. It's recommended that you take it for at least 3 months, but if you have PCOS, you may actually want to start taking it earlier so you can start regulating your cycles before starting any fertility treatment. We recommend that you take myo-inositol 2,000 to 4,000 milligrams per day. There is another form of this supplement available called D-chiro-inositol, and it's recommended that you have between 50 to 100 milligrams of this per day in a 40 to 1 ratio with myo-inositol. If you want to take both, make sure that the supplement you choose has a 40 to 1 ratio. And this is something you may want to consider with PCOS, but myo-inositol is sufficient. You can buy this in lots of places like Amazon. There's a few that I recommend that I will go through with you, and is recommended for people with PCOS in women who are over the age of 35. And studies have shown that it may possibly be helpful for women with low ovarian reserve as well. Number 4, vitamin D3 with K2. Vitamin D is critical for hormone regulation, especially AMH levels and ovarian function. Many women are deficient, especially in the UK, as there's such little sunlight. Vitamin D3 helps to absorb calcium from food and supplements into your bloodstream, which is really good for your bone health and really good for your ovarian function and immune function. However, there is a catch, and that is that you need it with K2. K2 makes sure that the calcium ends up in the right place in your body. If you don't have K2, the calcium that you take in can be deposited into your arteries or soft tissue instead of your bones, and this is bad news for your heart health. We don't want calcium in our arteries. Vitamin K2 activates a protein, and then that tells your calcium where to go. So it will redirect it to your bones, your teeth, and your reproductive system, which is where we want the calcium to be. It's recommended you take this every single day, especially through the winter months, at least for 3 months. But I recommend you just take it every single day throughout the entire year. If you're deficient, you may require more, but this is something you'll need to discuss with your doctor as it's required on prescription. Vitamin K2, it's recommended you have between 90 to 200 micrograms per day for good bone support. A bonus tip for taking this is to have it with fat, like with a meal or with an omega-3 supplement, because that helps to boost absorption. Both vitamin D and K2 are fat soluble, so it will help it to be absorbed better if you have it with a meal. Number 5, NAC. NAC is an antioxidant and a precursor to glutathione, which detoxifies cells and reduces inflammation, which is really common in patients with endometriosis and PCOS. This helps to reduce oxidative stress and improves egg maturation. It's recommended that you start this 2 to 3 months before egg freezing, and the dosage recommended is between 600 to 1800 milligrams per day, often in divided doses throughout the day. It is recommended for patients with PCOS. It is very helpful for this because it helps to lower testosterone and insulin resistance, which can happen in PCOS. It's also useful for patients over the age of 35 because it can help with the antioxidant support. If you have low ovarian reserve, it can help with supporting egg quality, and in endometriosis, it can also help with the anti-inflammatory benefits. If you want to know more about the supplements you should be taking, you can check out the whole supplement cheat sheet along with my list of supplements I recommend that you can take. I hope this helps, and I'll see you in the next module.